Welcome back to Chapter 1, Strategic Human Resources Management, second part based on human resources in healthcare. Managing for Success, 5th edition, the SHRM process, components and alignment. Now that we've covered the foundations of HRM, let's explore how the process actually unfolds within healthcare organizations. Strategic Human Resources Management is a cyclical and integrative process that aligns internal workforce capabilities with the organization's long-term goals. The first step is conducting internal and external environmental assessments, often through a SWOT analysis. This means identifying internal strengths and weaknesses and external opportunities and threats that could affect workforce strategy. For example, a hospital may view its strong nursing culture as a strength, but recognize physician shortages or turnover risks as threats. Organizational mission and corporate strategy. Every HR plan begins with understanding the organization's mission, the reason it exists. In healthcare, the mission statement offers clues about the values and skills that matter most. For instance, a children's hospital's mission might emphasize compassion and family-centered care, guiding HR to prioritize empathy and communication in hiring and training. Corporate strategy operates at 3 levels. Corporate level, the overall direction of the organization. Business level, the competitive positioning of a specific service line or facility. Functional level, departmental strategies that support overall goals, including HR, finance, and operations. HR plays a crucial role at each of these levels by ensuring that people, culture, and performance systems reinforce the organization's direction. At Cleveland Clinic, for example, HR collaborates with operations leaders to ensure that staffing and training align with their patient-centered, patients-first philosophy. HR strategy formulation and implementation. There are 3 major HR strategies that directly support business goals. First is the staffing strategy. This includes workforce planning, recruitment, and selection. A growing organization might focus on expansion hiring, while one facing financial constraints may use retrenchment or redeployment strategies. For instance, Advent Health redesigned its staffing model during COVID-19 surges by reallocating internal talent to high-demand units. Second is the developmental strategy. This focuses on performance management, employee development, and career progression. It ensures employees have the right skills for the organization's current and future needs. For example, Texas Children's Hospital created leadership academies to prepare frontline managers for executive roles, strengthening its internal talent pipeline. Third is the compensation strategy. This includes pay structures, incentives, and recognition programs that drive desired behaviors. A health system emphasizing innovation might reward creative problem solving, while another focused on quality might offer bonuses tied to patient outcomes. For instance, Intermountain Healthcare uses performance-based incentives linked to clinical quality, teamwork, and cost efficiency. In SHRM, all these strategies must complement one another. If one system promotes teamwork while another rewards only individual results, the organization sends mixed signals. The goal is strategic alignment. Every HR decision should move the organization closer to its mission. Key organizational factors influencing HR strategy. Several organizational elements shape HR strategies: organizational design and culture. The structure of jobs and reporting relationships influences how people work together. Some healthcare systems operate under traditional hierarchies, while others use flatter, interdisciplinary models. For example, Kaiser Permanente promotes integrated care through cross-functional teams that blend clinical, administrative, and IT expertise. Technology and information systems. Digital transformation, from electronic health records EHRs to AI-assisted scheduling, has changed how HR operates. Data analytics and automation now support evidence-based workforce planning, competency tracking, and performance evaluation. Workforce composition and trends. Healthcare organizations now manage multi-generational and multicultural teams. Baby boomers bring institutional knowledge. Gen X leaders value autonomy. Millennials and Gen Z employees seek flexibility and purpose. Recognizing these differences helps HR craft engagement strategies that appeal to all groups. For instance, Mayo Clinic tailors its benefits and mentoring programs to meet diverse generational expectations, outcomes, and performance. The effectiveness of SHRM is ultimately judged by outcomes, both human and organizational. HR outcomes. These include employee satisfaction, motivation, retention, and well-being. Metrics such as turnover rates, time to fill, and training ROI help evaluate HR's impact. The HR scorecard is a valuable tool for this purpose. It translates HR practices into measurable indicators of performance, connecting people metrics to financial results. For instance, Cleveland Clinic tracks engagement scores, turnover trends, and patient experience simultaneously to demonstrate the link between culture and outcomes. Organizational outcomes. These are broader measures like growth, profitability, quality, compliance, and stakeholder satisfaction. When HR strategies are well aligned, they directly enhance operational excellence. Healthcare systems that invest in employee well-being consistently report lower medical errors, higher patient satisfaction, and stronger financial performance. Predictive HR analytics represent the future of evidence-based HR. By using big data and statistical modeling, HR leaders can anticipate turnover risks, identify high-potential employees, and forecast future staffing needs. For example, HCA Healthcare employs predictive analytics to reduce nurse turnover, improving both employee morale and patient continuity of care. Branding and strategic perspective. In the competitive healthcare labor market, HR branding has become a strategic differentiator. An HR brand represents how employees and candidates perceive the organization, its values, culture, and reputation as an employer of choice. When employees identify with the brand, they act as ambassadors who strengthen organizational credibility. For example, Johns Hopkins Medicine markets its mission of excellence and innovation to attract top clinical talent globally. A strong HR brand provides three strategic benefits: attraction of highly qualified professionals, retention of engaged, loyal employees, alignment between organizational image and workforce experience. A strategic HR perspective views employees not as variable costs but as long-term human assets. This mindset requires consistent investment in training, career development, and culture, similar to how organizations invest in technology or infrastructure. Healthcare systems like Mass General Brigham exemplify this by funding professional growth programs that reduce turnover and build institutional resilience. Who performs HR tasks? The final topic in this chapter explores who actually carries out HR responsibilities in modern healthcare organizations. Traditionally, HR departments handled most personnel functions, but today there's a shift in locus. Line managers, department heads, and even team leaders are now directly involved in HR decision-making, from hiring to performance feedback. Routine HR tasks like payroll, benefits management, and recruitment are often outsourced or managed through shared service centers. This allows HR professionals to focus on strategic priorities such as performance improvement, succession planning, and organizational development. Modern HR leaders, particularly Chief Human Resources Officers (CHROs), serve as strategic advisors who guide executive decisions and shape culture at the board level. They influence major areas such as CEO succession, compensation policies, and change management initiatives. For instance, Ascension Health CHRO sits on the executive leadership team to align workforce planning with long-term population health strategies. This integration of HR into governance reflects the evolution from administrative management to strategic partnership. Key takeaways and leadership implications. Let's conclude with key insights for healthcare administrators and leaders. First, people are not a cost, they are an investment. The workforce is the driving force behind patient care, innovation, and organizational success. Second, strategic alignment between HR and business strategy is essential for achieving the Quadruple Aim. Healthcare organizations that integrate workforce planning, development, and analytics outperform those that treat HR as a back office function. Third, effective HR leadership requires adaptability, empathy, and evidence-based decision-making. Healthcare executives must understand HR systems, champion employee well-being, and lead with integrity. In today's healthcare environment, strategic HRM is not just a department, it is the heartbeat of the organization. Reference Chapter 1, Strategic Human Resources Management.